Today I'd like to discuss the difference between a full tummy tuck or abdominoplasty and a mini tummy tuck. I do get a lot of questions about it, and I think it's important to clarify who would qualify for one versus the other. So I have this little diagram just to simplify things. So for a full tummy tuck, the incision is typically from about hip bone to hip bone. Sometimes it does extend a little further depending on where the loose skin stops. All of the skin is removed. So from about the belly button down, sometimes we go even higher depending on how much loose skin there is. All the skin above the belly button gets pulled down nice and tight. We do create a new opening for the belly button. That's really beneficial. A lot of people, as they have loose skin, the belly button starts to kind of look like a line, or you can't fully see it. So we create a new opening that's very natural looking. And the other benefit of a full tummy tuck is we're going to do muscle repair from top to bottom. So that's what this line is signifying. So we're going to do layers of sutures that are permanent. That's going to be like an internal corset to bring back the abdominal muscles together, as the abdominal muscles tend to get stretched with pregnancies or with weight gain. And then typically we're going to do liposuction of the waist, so from about here out to help with contouring. Now, some patients say, well, do I need a full tummy tuck? Can I just get a mini tummy tuck? And patients ask this often when they don't have a lot of loose hanging skin. They sort of can't imagine that they would need a full tummy tuck. But a mini tummy tuck is really reserved for just a few people that are good candidates for it. I tend to not do a lot of mini tummy tucks at all. And I'm going to explain to you why. So mini tummy tuck sometimes can be a shorter incision, but sometimes does have to go hip bone to hip bone. And we're removing just a little bit of skin at the bottom of the abdomen. So this amount of skin gets removed, this skin gets pulled down. So if you look at the belly button, we're not touching it. We're really not making changes to it. We're not making changes to the tightness of how the entire abdomen looks. We're really only removing like a little bit of hanging skin at the bottom. And then typically we can do muscle repair, but only at the bottom of the abdomen because we're not getting access up here. So we can only repair stretched muscle at the bottom. The real benefit of a mini tummy tuck is we can safely do liposuction of the entire abdomen as opposed to just addressing the waist. Now, why are most people really a better candidate for a full tummy tuck? And the reason is if you think about the mechanism in which the abdomen gets stretched in pregnancy or weight gain, then you realize that basically the entire abdomen gets stretched, the upper and lower abdomen. And it's very uncommon that the skin has not been compromised in the upper abdomen as well. And so when we have stretched out compromised skin in the upper and lower abdomen, the best way to address it is with a full tummy tuck. That's going to address skin, muscle, and fat in the entire abdomen. And another way to think about this is to look at the appearance of the belly button. And typically when you start to see kind of that horizontal line over the belly button that I mentioned, or you notice that there's skin looseness above the belly button, that's a good sign that your upper and lower abdomen skin has been affected and you're a better candidate for a full tummy tuck. And then the other thing to think about is with pregnancy, the entire abdomen is stretched, upper and lower abdomen. So most women really can benefit from getting that muscle repair in the top and the bottom abdomen. You don't want to end up with sort of a tight appearance at the bottom of the abdomen and still have bulging at the top because your muscle hasn't been addressed. So when I evaluate patients for a tummy tuck, those are the things I'm looking at. Has your muscle been stretched and doesn't need to be repaired? And has your skin quality been affected in the upper and lower abdomen? And if so, for most people, then a full tummy tuck is better. Now, most people's concern about a full tummy tuck is the length of the incision. And yes, sometimes it is a longer incision, but remember, it is designed to be low and hidden. So you should easily be able to cover it up with normal underwear, normal bikini. And not only that, the incision tends to heal really thin and beautifully over time. The other concern that patients have about a full tummy tuck is recovery. And the truth is, it's not really a difference in recovery between a mini and a full. I would say with a full tummy tuck, you're looking at about 1 more week off of work, 1 more week of no driving. In the grand scheme of things, I think it's much better to choose the more comprehensive treatment plan for you, and know that you're just going to need a little bit more time off. And lastly, just to briefly talk about time off work, for a tummy tuck, I typically recommend 3 weeks off work. If you are working from home, you probably can return to work after 2 weeks. And no driving for 2 weeks, and you will need help at home for at least 1 week after your surgery. So count on needing actual help to get up, to go to the restroom, to take a shower, to get dressed. So once you're sure that you have that, 1 week of help at home, that 2 weeks of not driving, and the 2 to 3 weeks off work, you're all set to be really prepared for your tummy tuck and an amazing outcome. So please reach out to me for any questions or concerns. If you'd like to schedule a consultation, you can direct message me or you can reach out to our office. Thank you.